Rethinking phantom limb pain treatment. A breakthrough discovery challenges conventional wisdom. Imagine living with the constant pain of a limb that isn't there. That's the reality for many amputees suffering from phantom limb pain, a condition affecting up to 87% of individuals after amputation. But what if the way we understand and treat this pain is fundamentally flawed? New research is challenging the long-held belief that the brain's map of the body changes drastically after losing a limb. In a groundbreaking study, researchers from the University of Pittsburgh and several other institutions have discovered that the brain's somatosensory cortex, which processes touch and other sensations, remains largely unchanged after amputation. This finding is based on a detailed comparison of 3 patients' brain activity before and after hand amputation, challenging the status quo. For decades, the prevailing theory has been that when a limb is amputated, the brain's map of the body undergoes significant reorganization. It was believed that the areas of the brain responsible for the missing limb would be taken over by neighboring regions such as those controlling the lips or face. However, this new study contradicts that notion. The brain's body map remains highly preserved after amputation, explained Dr. Hunt. The patients underwent the amputation for various reasons, including a rapidly developing arteriovenous malformation, a slow-growing sarcoma tumor, and multiple bone fractures due to Servelle-Martorell syndrome. The study also included a control group of 16 able-bodied individuals and data from 26 chronic upper limb amputees who had their surgeries an average of 23.5 years ago. #Key findings. The researchers used functional neuroimaging to assess motor control, kinesthetic vividness, and pain levels. Participants performed tasks such as finger tapping, lip pursing, and toe flexing during brain scans. The results were striking. The brain's maps for the hand and lips remained consistent, both before and after the amputation. We were struck by the remarkable stability of the hand map, even after years without the hand's rich sensory input to the brain, Dr. Schoen noted. The hand map did not fade over time and retained such precision that a machine learning algorithm trained on pre-amputation finger movements could accurately predict phantom finger movements years later. Implications for treatment. These findings have significant implications for the treatment of phantom limb pain. Traditional therapies such as mirror box therapy, virtual reality, and graded motor imagery focus on retraining the brain. However, the new research suggests that these methods might not be addressing the root cause of the pain. Instead, the study points to the potential of reconnecting severed nerve to muscle or other tissues to reduce the risk of phantom pain. This approach could be more effective in managing the condition, especially when combined with advancements in brain-computer interfaces, BCIs. These findings call for a critical rethinking of phantom limb pain treatments, shifting focus downstream toward peripheral nerves and the spinal cord, Dr. Schoen emphasized. Future directions. Dr. Schoen and his team are eager to explore why the brain maintains these maps in the absence of sensory input. This persistence suggests that the somatosensory cortex plays a more active role than previously thought. Because the adult brain maintains these sensory-deprived representations, they can serve as a stable foundation for clinical translation of these technologies. Dr. Schoen added, the goal is to leverage these preserved maps to develop next-generation BCIs that can restore movement and sensation for individuals with amputations or spinal cord injuries. Chapter controversy and discussion, but here's where it gets controversial. Some experts argue that the brain's adaptability is still a crucial factor in phantom limb pain, and that focusing solely on peripheral interventions might overlook the brain's dynamic nature. What do you think? Should we prioritize peripheral nerve treatments or continue to explore brain-based therapies? Share your thoughts in the comments below.